Good morning, everyone. Welcome to another episode of Tiny ADHD Superpower Knowledge. This is episode 69, and it's on ADHD and alcohol and nicotine. People with ADHD tend to be more impulsive and likely to have behavioral problems, both of which can contribute to drug and alcohol abuse. Research says also both ADHD and alcoholism tend to run in families. A child with ADHD who has a parent with alcoholism is more likely to also develop an alcohol abuse problem. Though alcohol is a depressant, for those with ADHD, it can actually have the opposite effect. This is what I find interesting. When a person drinks alcohol, it affects their frontal lobe, which is responsible for clear thinking and decision making. Individuals with ADHD may engage in impulsive behavior that can lead to harmful consequences. When they consume alcohol, these symptoms can increase. I had that experience. Alcohol had also intensified symptoms of inattentiveness and restlessness. With prolonged heavy drinking, those with ADHD may experience an intensified anxiety symptom and have difficulty managing their emotions. Stimulants like Adderall are commonly prescribed for ADHD. These medications work by increasing the central nervous system activity by counteracting symptoms of ADHD. On the other hand, alcohol depresses the central nervous system. By consuming it while taking ADHD medication, it can change how the medication is processed in the brain and essentially canceling each other out. It can cause side effects such as increased blood pressure, irregular heart rate, impaired judgment, nausea, vomiting, raised body temperature, trouble sleeping, and seizure. Alcohol is also known to increase some symptoms of ADHD, including inattentiveness, impulsivity, and lack of proper decision making. Additionally, there could be a link between insomnia. Those with ADHD and alcohol consumption, insomnia causes difficulty falling asleep or staying asleep. Alcohol can disrupt sleep patterns and therefore exacerbate insomnia in those who also struggle with ADHD. Combining alcohol and stimulant medication can increase the risk of alcohol poisoning and overdose. Taking these substances for a prolonged period increases your risk of a heart attack or stroke. Also, since ADHD medication tend to reduce appetite, drinking on an empty stomach while you're taking this medication can make you drunk faster and it hurts your stomach. As for non-stimulant ADHD medications and alcohol, the interaction is generally less severe, though it's advised to never, ever combine medications and alcohol. Depending on whether you have pre-existing condition or if you have medicine is short or long-acting, you can put your body at risk of dangerous side effects when combining these substances. But here's the twist. Alcohol also increases the release of dopamine in your brain's reward center. The reward center is the same combination of brain areas that are affected by virtually all pleasurable activities. That's very interesting. Because those ADHD tend to seek rewards, they turn to alcohol for its initial feel-good effect. When a person drinks alcohol, their body produces extra dopamine, which affects the reward center in our brain. As a result, the alcohol effects can feel initially rewarding for those with ADHD, but can lead to addiction. Lastly, both ADHD and alcohol addiction may be genetic. Researchers have also discovered common genes shared between ADHD and alcoholism. Thank you, guys.